All right, SABC News foreign editor Sophie Mokoena now joins me live. May Sophie, good evening to you. So in South Africa, let's start here. It was a historic day in the country. Do you think South Africans would now be convinced to avail themselves for vaccination?
I think South Africans will continue to ask questions, and they will continue, some of them, not being available to receive the vaccines because it's natural, it's normal, and people don't just buy in on something that is new. But what is critical is to ensure that the communication and information is correct, timelessly, and also the leaders themselves must send a clear message and they don't contradict each other. For an example, people are asking questions around the expiry dates of the Johnson & Johnson now, and I think the minister must be quick to explain that question, or to answer that question, and also going forward, clear indication what's coming, when, and who will be next in line.
So where's the rest of the continent with the rollout? I understand Zimbabwe is on the cards.
Yes, Zimbabwe tomorrow, they'll be starting at 10 o'clock, but let's look at these graphics or slides that indicates exactly what's happening on the continent. You'll see that when you look at the first slide here, you see that the first region, that is the SADC region, South Africa and Zimbabwe. South Africa started today, tomorrow it's Zimbabwe, but Mauritius and Seychelles have started with little doses. When you go to the north, you have Egypt and Morocco. In particular, Morocco is leading in terms of doses. When you go to East Africa, Rwanda has started, and when you go to West Africa, Guinea has started, thanks to Russia for availing that Sputnik. And when you look at the second slide, you'll see that it speaks to number of doses in terms of, for example, a country like Seychelles got the vaccines from China, 50,000 doses. And then you go to Mauritius, you have AstraZeneca. In other words, Mauritius is still using the AstraZeneca. Egypt is using the China vaccine. And then Morocco is using AstraZeneca. And Guinea is using Sputnik. South Africa, of course, we have started with Johnson & Johnson. And the announcement was made a day ago that South Africa will donate the AstraZeneca vaccines to all those countries where you don't have a problem of the 501Y-V2 variant, because they can still use the vaccine.
Yeah, with that update from the continent, what is the progress on vaccination around the world?
Well, around the world, I think developing countries are far by now. You're counting millions in a country like the United States of America. You look at Israel, they've done very well. And then you look at Europe, it's a race against time. Today, the European Union had a media briefing where they were talking about order of 300 million vaccines to ensure that all member countries have enough supplies. And you look at the United Kingdom, they are also doing well, using different vaccines to ensure that they continue. A country that started with the Pfizer vaccine, but now really leading. And you look at Asia as well, many countries in Asia are doing very, very well. And also countries such as Russia, they have now kind of powered forward in terms of promoting their vaccine, that is the Sputnik. And therefore, I think the global north is doing very well. The global south is still struggling. But these kinds of visuals in South Africa are giving an indication that it is a small step, but perhaps we are moving in the right direction. And tomorrow, the World Health Organization Sub-Sahara region, Dr. Matshidiso Moeti, is going to give us a brief information in terms of comprehensive information about where the continent is. Later, you'll have Dr. John Kenkesong, who is the head of the CDC for Africa, who is also going to share more information in terms of what Africa is doing.
Right, we look forward certainly to those updates. Thank you very much indeed. SABC News foreign editor Sophie Mokoena joining us live here in studio.